National Hospital Abuja has inaugurated its telemedicine unit for the diagnosis and staging of breast cancer. Telemedicine is the distribution of health-related services and information via electronic information and telecommunication technologies such as phone, video, and other virtual methods. It is a method which provides medical care remotely with benefits of long-distance patients and clinical contact, care, advice, education, intervention, and monitoring using communications technology. The hospital's head of radiotherapy and oncology department, Dr. Uchechukwu Shagaya, said that the unit was designed to bring specialists closer to patients for speedy and efficient care. The unit was established in partnership with Pfizer Biopharmaceutical Group. The inauguration also featured a seminar on the use of telemedicine in the diagnosis and staging of breast cancer. Shagaya added that by bridging the gap, doctors will be guided to know how to refer patients for radiotherapy and chemotherapy.
One of the problems we've been having is late presentation. Some patients will tell you that I was going to the doctor, they told me that there's nothing wrong with my breast. You will hear that. But with sessions like what we've just had and what we plan to be having regularly, then the doctors who are in the rural areas, who are not oncologists, will know exactly what they're supposed to do for the diagnosis, so that by the time they send them to tertiary centers, they've started the process. Nothing has been missed out. So it will definitely improve patient outcome by improving the detection and then the treatment. If I'm able to get every doctor, whether you're rural or urban, hear the lecture we had today, nobody will make a mistake with diagnosis of breast cancer.
She said that the inauguration of the unit was the first phase of the implementation.
The telemedicine that we're launching in National Hospital today is phase 1, where the healthcare provider, a doctor, can call a number and speak to another doctor who is a specialist. We are allowing them to do for now for 10 minutes or less. And if they want more, of the discussion, a more detailed discussion, they can actually schedule a virtual meeting. The phase 2 of this, we plan to actually be able to consult with patients. With the phase 1, we're able to do the healthcare provider consultations. We're going to do trainings online. We're going to do webinars. We're going to be able to reach out with the help of NMA, doctors in rural areas.
The medical director, Pfizer Biopharmaceutical Group for Sub-Saharan Africa, Dr. Soro Kojo, said that the benefits of using telemedicine for the diagnosis of breast cancer were tremendous.
Just like you saw Dr. Shagaya mention, there are some patients that will not be able to go abroad for treatment. But through this, they will be in Nigeria here and still have that expert input in their management. It's unquantifiable. Nigeria will save a lot of billions of dollars that we are spending in going abroad for treatment. Because it's just partnership, not Pfizer to Pfizer and National Hospital, also the National Hospital with experts outside the shores of this country.
Kojo also said that because there were limitations to the diagnosis and staging of breast cancer, the group was also working not only with the National Hospital but with pathologists across the country.
So Pfizer's collaborations are using the National Hospital platform to bring this technology. This is the first in this sub-region, so we're so happy to partner with that. So that's part of addressing our blueprint, which means reaching the last patient faster. How can we reach the last patient faster? So this technology achieves that aim.